The idea of implementing safe staffing limits for nurses has been discussed by the Massachusetts legislature since the late 90s. In the mid-2000s, safe staffing legislation passed in the Senate budget, but was not taken up by the Ways and Means Conference Committee. In 2005 and 2007, patient limit legislation passed in the House of Representatives, but did not get through the state Senate. After unsuccessful attempts in the legislature, the Massachusetts Nursing Association decided to go directly to the voters. On November 6th, Massachusetts residents will be asked to vote on question 1, patient-to-nurse limits. Last week, we found out the reasons why Beth Israel Deaconess Hospital Needham is against the ballot question. This week, State Representative Denise Garlick, who also worked as a nurse, stopped by the studio to explain why she believes voters should vote yes on the initiative.
Simply, the problem is that nurses are being asked to care for too many patients. Research tells us, common sense tells us, there's a limit on the number of patients a nurse can care for, and we know that complications happen. Complications may be med errors, infections, readmissions, and sometimes, and documented, is deaths. We know this is verified research. It's published in peer-reviewed journals. University of Pennsylvania nursing program has been a lead in this through the work of Linda Aiken. The Institution of Medicine came out with a document that says there is a limit on the number of patients a nurse can care for safely. So let's all decide that we are united on what we think the problem is. What we are not united on is what the solution is. So let me tell you the things that we need to get off the table. People who say the solution is that there have to be patient limits, that means that we're going to hire more nurses. We hear an argument against that there's a nursing shortage. Let's get that off the table, everyone. Common sense, no nursing shortage. We ourselves know that there are vacancies in the hospital that are left unfilled. Hospitals are offering early retirement programs to nurses. We know young, brilliant students that are coming out fully prepared from accredited nursing programs who cannot get jobs in acute care hospitals. And we all know nurses who are out there selling insurance and real estate because they won't work under the unsafe conditions. If we pass this law, there will be nurses. The second argument I just want to clear the table with is this terrible argument around the emergency rooms, which is a campaign of fear. I am sorry that people are being frightened. Massachusetts today ranks 48 out of 50 states in the wait time in the emergency rooms. We've got a separate issue there. This law isn't going to develop that issue. We have to solve that issue. You solve it, put more nurses in the emergency room, put more nurses on the floor, and it's going to make perfect sense that we're going to be able to move people more quickly. Let's wipe that off the table. The third one is this terrible statement about let's get government out of healthcare. Listen, that's a red meat statement that was directed to voters who don't want government involved in healthcare at all. I will tell you, as a legislator and as a nurse, government is involved in our healthcare every single day, thank God. From Medicare down to our Department of Public Health that licenses our hospital, enforces our regulations, and makes sure to the best of their ability that the care that we need and want is being delivered safely. So we do want government involved in our health care. So if we get rid of those arguments, we are left with the real argument. And that argument is about money. And that is a real argument, and it is a real struggle. It's a struggle for our hospital trustees and our advisory board that have a fiduciary responsibility, for our hospital president, who is someone I deeply respect. I understand that that's a real concern. I don't think it's as little money as we hear from the proponents. I don't think it's as much money as we hear from the people that are against this referendum, but I think it is an issue we have to decide about. So this is the decision. Where do you want your money spent in healthcare? Me, I want it spent at the nurse, at the bedside. I want to know that the person at my bedside is able to take care of me. It has the assessment and judgment to intervene appropriately. The patients in the hospital today, whether it's you or it's your child, are so acutely ill. People come into the hospital now, they are coming in on the same day of their surgery, or they are coming in so ill, they are staying in only for that acute phase, and then they are being moved out to rehabs and step downs, or they're going home. Period of time they're there is an acute period of time. They need appropriate intervention, timely, qualified, experienced intervention. The reason that that hasn't been solved so far is around the issue of how did we get here. In the 1990s, the hospitals were deregulated. At that time in Massachusetts, at that time, there was a political belief that increased competition would drive up quality and drive down costs. That's not what we saw. What we saw was this incredible competition with winners and losers, and we see our hospitals struggling in that competition. The winners and losers cannot be the patients. That cannot be where we make this final decision. The money that we spend in healthcare has to be common sense. We have to know that we need to ensure that there are a sufficient number of nurses. The only way you do that is to put a limit on this, or else you take that same band of people and this false argument about wanting flexibility. The flexibility isn't so that the hospital administrators can decide how to move patients or how they're going to move around their staff. It's how they're going to deploy the same number of nurses in critical situations. What that means to you and me is you start out at 7 a.m. and your nurse's name is Carol and she's got 5 or 6 or 7 patients. You may or may not be a top priority. But what's worse is if someone 3 rooms down the hall has an acute episode and they decide they need Carol down there too, they take Carol from you. They take Carol from the person you love, from their bedside, and move them because they just don't have enough nurses. We have to say there has to be a limit. We know that by saying there's a limit, we need to hire more nurses. We know the nurses are available, and we know that this is what healthcare is really supposed to be about. Somehow, in the middle of this multi-million-dollar public relations campaign that we are witnessing, people believe that they now have to choose. They're choosing on false issues, or they're choosing between nurses who are speaking for 2 different solutions, right? One group is the bedside nurses who are asking you to vote yes. They're asking for your help. They're asking for more nurses at the bedside with a limit on the number of patients they care for. The other side are also nurses, but they are management nurses, and they are nurses that need, for a variety of reasons, to use a different calculus. Their calculus is not who is at the bedside. The nurses who are at the bedside are asking you to vote yes. I was a nurse at the bedside. I know what that means. I'm asking you to vote yes. I'm voting yes for me and for my family. We need to move into the future with a healthcare system that we know and that we can trust. And in all the many factors that have to be considered in healthcare today, the most important fact is that quality of patient care. That is what ultimately it needs to be about. All these other factors are important, but nothing is more important than the person who is the patient and what that patient needs and deserves, and we need to ensure that patients will get that care.